Hello friends, my name is Dr. Akshay Jain and I am Associate Professor in Government Medical College Kota, and I have been practicing for last 12 years in Kota and Udaipur and then again in Kota, and right now I am in private practice as well as government setup. Today I will be talking about atopic eczema. As we all know, atopic eczema can affect any age group from a newborn infant to an elderly who is 90 years old. So there is no age distribution for this particular disease, but it starts in early childhood in many cases and it lasts the rest of the life. And generally, these cases improve when there is puberty attained by the child. In atopic cases, there is a condition known as atopy, which has a triad of three conditions in one single terminology, and that indicates about propensity towards various allergic conditions in the body, like allergic rhinitis, allergic asthma, and the third one, which we are referring to, is atopic eczema. So it is very well understood that those who are having asthma are prone to have atopic dermatitis also, and same way those who are having allergic rhinitis are prone to have atopic eczema as well as asthma also. So it is a cascade of three various target organs which ultimately leads to a single condition known as atopic eczema. So how does it start? Basically, there is a deficiency in the skin barrier function, which leads to dehydration of the topmost layers of the skin, and there is dryness and scaling of the topmost layer of the skin. So the epidermal barrier function is impaired, and the as the function is impaired, there is propensity towards infections and itching and scratching. There may be papular lesions on the skin, and there may be recurrent folliculitis like lesions. The symptoms of the disease vary according to the age group which we are referring to. Like in a newborn, you will see chapped skin or cracked skin or various annular lesions on the cheeks, on the hands, and extensor aspect of the surface. Then in a child somewhere around 2 to 5 years, toddler, which we call as toddler age group, you will see the lesions on the surfaces which are touching the ground or the toys or the sofa covers or the bicycle, etc. Then in again 12 to 18-year age group, generally these children who are having atopic eczema, generally they show improvement because of the puberty. There is a production of the sebum from the body. Inherent sebum production starts by that age group. So those patients who improve by this age group may not have this again in their entire life, but many cases do not improve at all and they persist to be the cases of atopic eczema. And again, there is variation in the site of the lesions, and then comes the adult group where you will see the lesions just opposite to the children. The lesions are more on the extensor aspect of the joints and body and knuckles of the body and nape of the neck. And especially I would like to mention here that in adults the atopic dermatitis of the face is very common, like a newborn child, and these cases are generally misdiagnosed or undiagnosed, and they present as the cases of sensitive skin or seborrheic dermatitis, to us many times misdiagnosed as seborrheic dermatitis or sensitive skin cases. But generally they are cases of atopic dermatitis which are waiting to be diagnosed. So a caution is most importantly needed when you are seeing a case of suspicion where there is no diagnosis or the diagnosis is doubtful. You should always consider about atopic dermatitis of the face. And then in the elderly who are above 50, again there is loss of the sebum production, and in these cases also there is this dryness of the skin, so again there is propensity towards atopic dermatitis. Now this about this lesions of the atopic dermatitis and age group. Now what actually happens in cases of atopic dermatitis? There is a desire to scratch because of the dryness and change in the inflammatory milieu of the interleukins and cytokines in the epidermis due to defective barrier function and various pathogens which inhabit the stratum corneum. due to the breach in the security of the skin layers. So this change in the milieu of the skin leads to various interchange in the internal system of the itching perception by the person, and there is increased desire to itch. And because the skin is inherently dry, genetically dry, and these people are genetically prone to dryness, this one interesting aspect of atopic dermatitis is that these people have this disease running in the family like asthma or allergic rhinitis, and there may be generations which are affected with this disease. So this desire to itch leads to scratching and then folliculitis and then infections and then maybe very serious complications later on. Now comes the treatment part. What actually helps you to diagnose a case as atopic eczema? So the diagnosis primarily lies in the clinical examination itself, history taking. Will you always have to ask about the history of allergic rhinitis as well as allergic asthma in these patients, and you may find out that those who were a case of atopic dermatitis in childhood has asthma in adulthood, or vice versa. Those who had asthma in childhood may have atopic dermatitis in the adulthood, and this runs in the families. So this about diagnosis. There is no other need for a diagnosis, but in laboratory you can do simple eosinophil count or IgE levels in these patients to label it as a case of allergic asthma. And now comes the treatment part. So most important aspect is we should not allow the skin to dry up. The skin should be wet, moist, and we should allow the patient to stay away from the possible allergens, which may be a fiber, synthetic cloth, or something which is irritating the skin or producing the scratching. So like woolens made of the wool, they will always lead the patient to scratch uncontrollably. So you have to take care of it, and then plenty of moisturizer which should be applied on the wet skin. And then if the patient is not able to control the itch, then you have to add antihistaminics. If not, the antihistaminics are working, then you have to go for the antipruritic agents like in elderly. And you have to add certain immunomodulators as well, be it oral steroids, be it methotrexate, be it cyclosporin or azathioprine in cases of atopic dermatitis not controlled by simple interventions like phototherapy, topical steroids, topical moisturizers. And one most important thing is that the pH of the skin should always be balanced in these cases, because a slight alteration in the pH will lead to the causation of the folliculitis like lesions, and there will be more itch in the patient, and that will ultimately lead to distress. And the quality of life will be very terrible for these people who are suffering with atopic dermatitis, because they don't really know that what they have to do as far as treatment is concerned, because the more they itch, the more the disease worsens, and they are having sleepless nights. So our prime aim is to calm the patient, to counsel them properly, and to tell them about the chronicity of the disease, and to tell them about the proper medication as well as the proper precautions to be followed by the patient. Then comes the counseling part, and then comes the prognosis part. So we always have to tell that the disease increases in the winter part of the year, and there is better quality of life as far as the humid air is concerned, and patient should always follow whatever we are suggesting the patient to do, and that's how they can live a normal, almost normal life with lesser medications and better quality of life. Thank you. I wish you all a very happy new year, as well as stay safe and stay healthy. Stay indoors. Please take care of all the precautions necessary for COVID, as well as the vaccine which is available freely right now. Thanks a lot.